All right, so in this video, we're gonna review how to set up a PCA. You're gonna need to have 30 mLs an hour or more of a compatible fluid. Usually that's gonna be normal saline. Now, we're gonna take our syringe, we're gonna scan it to ensure that we have the correct syringe, and then we're gonna connect it to our PCA tubing. So we're gonna connect it here, and then we're very slowly and gently going to press down on the plunger, and we're gonna prime all the way to the Y site. Once we reach the Y site, we are gonna take a 10 cc syringe to flush the remainder of this line. After that, we can then go ahead and connect our TKO or our carrier fluid, whichever you prefer to call it. All right, so we're gonna take our syringe. These two little wings are gonna slide underneath this grate plate. It's nice to have the numbers visible if possible. And then I'm gonna go ahead and clamp this temporarily. All right, we're gonna go ahead and bring this piece down to kind of hug this in place, and then we're gonna lower this to clasp the top of that syringe. Now we can go ahead and unclamp here. And now we're gonna take our key, and we're gonna go ahead and lock the module. Now we're gonna hit channel select. It's gonna tell us to put the key to the program position, which is a side-to-side position. It looks like a minus sign like this. And it's gonna ask us about the size of this syringe. Keep in mind, it's not asking you how much fluid is in the syringe, it's asking you how big the syringe itself is. So this is a 50 cc syringe, so we're gonna go ahead and select 50, and then confirm. All right, and then we're gonna select our medication. So we're gonna select Dilaudid or hydromorphone. And be careful with your standard versus high concentration. Make sure that your syringe concentration matches what you're selecting and that matches the concentration noted on your MAR. For this purpose, we're gonna go ahead and select standard concentration. You're gonna see this listed here as how many milligrams and how many mLs. Keep in mind, oftentimes you need to divide this number by this number to get the actual ratio that is gonna be indicated on your MAR. So this is correct. We want a 1-to-1 ratio. And it's gonna remind us that we're gonna need 2 RNs to cosign at the end. This is for the end-tidal CO2 setup. In most cases, we won't be setting up an end-tidal CO2. For the purposes of this video, we're gonna go ahead and skip this. So I'm gonna go ahead and say confirm to bypass it. Again, we see our 1-to-1 concentration, 30 milligrams and 30 mLs, 1 milligram per ml. We're gonna say next. This relates to our end-tidal CO2, and again, we're gonna skip over this, so we're gonna select confirm. All right, and then you see our options. So 15% of the time in the inpatient population, it's gonna be PCA dose plus continuous. 85% of the time, it's gonna be PCA dose only, and you're rarely gonna see continuous infusion only. So I'm gonna go ahead and select PCA plus continuous. And then it's going to usually often ask you first for a max limit. It's important to note that we've removed the function in CS Link that allows physicians to order the max limit, so you can safely say no to that question. Now let's say we need to change some of these values. So if I wanna make my PCA dose based on the order 0.3, I click on that little triangle, and if I wanna change something else, I'll click on that triangle as well. So let's say I wanna make this every 10 minutes based on our order, and then I want my continuous dose to be 0.2. So we're gonna double check all of those independently, and then we're gonna hit confirm. At this time, it's gonna tell us to close and lock the door. So I'm gonna go ahead and lock that and remove the key. This is the screen that you wanna show your cosigner. So they're gonna verify your PCA dose, your lockout interval, your continuous dose if you have one, and also pay attention to the concentration down here. Oftentimes the cosigner might not see the setup from start to finish, so seeing this concentration right here is gonna be able to tell them whether or not it's programmed correctly in terms of the correct concentration between standard concentration or high concentration. So these are all correct. My cosigner's verified with my MAR, so we're gonna go ahead and hit start. Now, let's say half an hour from now or so, the patient complains of pain greater than a 6 and asks if we can do anything else for them. So at this time, what we can do is look at our order and see what our dose is for our bolus. So let's say that we have a 0.5 bolus. We're gonna go ahead and go to channel select. And then we do need the key for this. We're gonna hit bolus dose. It'll tell us to put the key in, so we're gonna put the key back in and turn it to the side-to-side position. And then I'm gonna bolus them with 0.5 milligrams, which is what is ordered, and we're gonna say confirm. Now it's gonna tell me to close and lock the door, and you see your bolus dose that's on deck to give right here. So we're gonna hit start to deliver that bolus dose. Keep in mind during this time, you're gonna wanna select on the MAR the hour that you're in, and then use the drop-down box to select clinician bolus. You'll want to, within the MAR, enter your pain level reported by the patient, and then you'll need to reassess the patient's pain within 59 minutes. Now let's say that we're gonna fast forward in time and now it's the end of our shift. So we're now going to go to channel select, and generally speaking, the physicians like for us to clear these volumes between 5 and 7, both AM and PM. So we've hit channel select, and now we're gonna hit options, and we're gonna select patient history. So this defaults to 8 hours, which isn't very useful for us. It may feel intuitive to skip to 12 hours, but what we actually want you to do is use the zoom feature to go all the way to 24 hours. Now the reason we're going to 24 hours is because since we clear this between 5 and 7, both AM and PM, for example, if night shift cleared this at 5:30 and then day shift cleared it at 6:45, there would be an hour and 15 minutes worth of medication that wouldn't be accounted for. So for this reason, we want you to zoom to 24 hours and then record your total drug given, the demands, and the delivered doses on your PCA flow sheet, and then we're gonna say clear history. Are you sure you wanna clear history? Yes. And then you'll see right there when it was last cleared. So if ever you were to find that you had a really large amount here and you were questioning if that was more than what was given during your shift, you can look right here and see when it was last cleared. So now that we've documented that, we're gonna go ahead and exit, and then we're gonna click start again. Now let's say we now need to discontinue the order. So what we're gonna do is we're gonna go ahead and go to channel off, and then we're going to open the pump like this, and we'll remove and waste our medication with a witness. And then to remove this module, you will pull down right here and then lift this up. It's important to note that this position right here is the only position that this pump can be in. The PCA module will not work in any other location. And if it were to be placed in another location, you would be able to unlock it from there using that same method by pulling this down and lifting this up.